Hi, my name is Allie Rice, and today I will be presenting an overview of adverse childhood experiences with the age of diabetes diagnosis, an examination of the 2021 BRFIS. Adverse childhood experiences, also known as ACEs, include intense stressors or traumatic events experienced or witnessed by children. They often occur without appropriate coping responses or access to mental health support. The relationship between the occurrence of ACEs and development of chronic disease is becoming more prominent. There is a lack of information concerning the impact of ACEs on the age of diabetes diagnosis. There may be a dose-response relationship between the number of ACEs and age of diabetes diagnosis. Our primary objective was to evaluate and describe the impact of ACEs on the age of type 2 diabetes mellitus diagnoses, utilizing the data from the 2021 Behavioral Risk Factor Surveillance System, also known as the BRFIS. Our secondary objective was to analyze the relationship between various demographic factors with the age at type 2 DM diagnosis. For our methods, we conducted a cross-sectional analysis of data from the 2021 cycle of BRFIS. Using survey design and sampling weights, we assessed prevalence rates of ACEs across sociodemographic variables and utilized binary and multivariable regressions to determine associations between sociodemographic factors and ACE scores on age of DM diagnosis. For this study, we included BRFIS participants reporting a diagnosis of type 2 diabetes and also having responded to the ACEs survey module. For our results, our population consisted of 12.59% of individuals reporting having diabetes. 11.98% of these individuals also included responses for age of DM diagnosis and filled out the ACEs survey module. Individuals experiencing 1 to 3 or more than 4 ACEs were diagnosed 2.15 and 6.37 years respectively earlier than those with 0 ACEs. Various ethno-racial groups were found to have a higher risk for earlier age of diabetes diagnosis. In comparison to white non-Hispanic individuals with 4 or more ACEs, Asian individuals with 4 or more ACEs were diagnosed with type 2 DM 15.6 years earlier. American Indian and Alaska Native individuals had the highest frequency of reporting more than 4 ACEs at 49.8%, while Asian individuals had the lowest frequency of reporting more than 4 ACEs at 8.9%. Finally, women were diagnosed 0.42 years later than men, and there was not a statistically significant difference between age at diagnosis and sex, nor among education levels. Our Figure 1 is a histogram of diabetes diagnosis by age, and Figure 2 shows the differences in age at diabetes diagnosis when reporting more than 4 ACEs from our adjusted regression models. In conclusion, our study found that individuals with ACEs are diagnosed 1.21 years earlier on average compared to those without. Individuals experiencing more than 4 ACEs were diagnosed with diabetes 4.22 years earlier than those with fewer ACE burdens. With an established link between ACEs and chronic health conditions like diabetes, early screening for ACEs might increase connection to care services and build resilience among affected individuals. Interventions focused on improved access to mental health resources in individuals with ACEs may reduce the incidence of substance use disorder and the deleterious effects in this population of individuals. Thank you very much.